The following segment is sponsored by Granger Medical Clinic. Are you suffering from physical pain that doesn't seem to go away? Dr. Nagpal is here from Granger Medical Clinic to talk to us about chronic pain. Welcome to the show, Doctor. Great to see you.
Thank you so much. Thank you for having me here today.
Of course, we're so happy to have you here. Okay, let's just start with, what is chronic pain?
I think that's a great question because a lot of people ask me, what do you do? What does that mean? Well, a lot of people suffer from chronic pain. Hundreds of millions of Americans actually do. And it's really, pain is a sensory, as we know, it hurts, but it's also an emotional experience. There's fear and concern involved. And chronic pain is really when it's lasting for a certain amount of time, 3-6 months, when it's really starting to be a part of your life, inhibiting your function, being able to take care of kids, all those kind of things.
Sure, and not going away. Now, what types of pain do you treat and what modalities are used for treatment?
Sure. So a lot of different types of pain. We focus on at Granger Pain and Spine, but spine is in that in the name, and we focus a lot on neck pain, low back pain, but major joints too, like the shoulder, hips, knees, the small joints in the low back, as well as the pelvis. And our modalities range in a multimodal experience of pain relief. So we like to focus on functional restoration with things like physical therapy. There's some medication management, but we focus a lot on interventional pain management. And that means doing injections for pain. That seems scary to a lot of people, but they can be a really nice way to treat chronic pain at certain intervals and keep people's functionality going and not having side effects from other medications.
Sure, and to be able to get that relief, I'm sure. Now, do you work with other care teams?
I do. So I have 2 partners at Granger Pain and Spine, but we also work with surgeons, including neurosurgeons, orthopedic surgeons, primary care doctors. The care team is a really important part of chronic pain. It affects a patient through all of their comorbidities, meaning their other medical problems. So I like to touch base with their primary care doctors, their cardiologists, whatever, so that we all have a plan that works well for that patient.
Definitely a team effort. Now, what are the goals in treatment of chronic pain? What goals are they?
I tell patients that chronic pain is very similar to other ailments that we suffer from. Think of asthma or diabetes. We don't necessarily have cures for those. We can't snap our fingers and make those diseases go away, but we have wonderful treatments that keep people functional, right? And that's what the treatment of chronic pain is like too. I can do epidural steroid injections or rhizotomies or do spinal cord stimulation to keep function. Now, people can have ebbs and flows with their pain, so they can have a pain flare or be doing great, and that's where we come in, is to reduce that flare. So maybe not curative, but helping people keep their functional goals.
Sure, so we can get some sort of relief from that chronic pain. Where can we go for more information, doctor?
So grangermedical.com. You can look at us on Facebook or Instagram. We have clinics in Tooele, West Jordan, as well as Cottonwood Heights.
Amazing. Thank you for the information and great to see you. Thank you, doctor.
Thank you.